The purpose of this podcast is to educate and inform. It is no substitute for professional care by your doctor or your qualified healthcare professional. Never disregard or delay professional medical advice because of something you've heard on this podcast or in any linked material. Guests who speak on this podcast express their own opinions, experience, and conclusions. Dr. Shirley neither endorses nor opposes any particular opinion discussed on this podcast. The views expressed on this podcast have no relation to those of any academic, hospital, practice, institution, or other entity with which Dr. Shirley may be affiliated.
Welcome to Forever Fab, the podcast on fashion, the art of living, and all things beauty. This podcast is curated by Dr. Shirley Madeir, MD, as the definitive source of holistic wellness through beauty.
Welcome back to part 2 of the Forever Fab podcast with my guest, Dr. Loretta T. Friedman. Now, Dr. Loretta, we've been talking about detox, metabolic protocols, etc. Is regular detoxing, again, helped by some of your protocols, is regular detox a necessary part of a wellness routine or an age management protocol? If we want to live well and have longevity and just feel fantastic until the very last day, is regular detox with some frequency necessary?
Well, here's the thing. I think the testing is necessary. I think that everyone should come in and have an age analysis, should have a toxicity test. And then we can see how much toxicity you have in your system. And then we know what you need to do. You know what I mean? It's like, because not everybody's toxic. Yeah. There are people who don't have enough toxicity to warrant doing a metabolic detox. They may want to. You know what I mean? They may want to do some homeopathics, or, they may want to increase their cell energy, which I do with mitochondrial support supplements every day that work really well. Or, they may want to, they move their bowels once a day. They want to move them 3 times a day. Who knows? So, but they need to find out how much. I always tell people, it's after the surgery that they come in because something happened. They got lymphedema, or the pain just doesn't go away, or, and I'm like, people should come in before, right. That's what preventative medicine is about. It's before you go and have the surgery. Let's see if you have toxicity, because if you have toxicity, then the likelihood is you're going to have inflammation that lasts for a very long period of time after your procedure. Longer than usual. So an inflammation lasts 3 to 6 months to begin with. Normally, it can take a whole year before inflammation goes away. That's why these like Tommy John surgeries, all these baseball players and stuff get. It's a whole year before they can go back to the motion that caused the injury to begin with, because it takes that long for inflammation to go away. So so come in before the procedure and see. Let's make sure that you're going to get through it okay, and that and then if you do have an issue after the procedure, you know where to go. We can get rid of that inflammation. 1, 2, 3. Okay, it's not a big deal.
I'm so glad that you mentioned that, because of course, as the plastic surgeon, I send my patients to get lots of tests before surgery. I also actually have them get some manual lymphatic drainage before, and a bunch of things, change the diet, etc., some supplements. But thanks to you, I'm going to add to that, pre-operative preparatory protocol for them to get an age analysis to determine how toxic they are. And as you mentioned, do this and find out this information before surgery. So thank you for that. I think that's going to be a game changer and very important.
I had a patient sent to me from a plastic surgeon. This is years ago. The woman had a facelift. She was in her 70s and literally had a one Sutton Place address. Yeah. Yeah, and I love that. I just love it.
Yeah, that's perfect. One Sutton Place.
6,000 square foot apartment, right?
Yeah.
And this whole side of her face was gravel. Gravel. It was lymph, and she comes in and I'm like, oh, yeah. I'm like, it's gravel. Feels like gravel. And I said, no, this is lymph. I said, I can fix this. I said, it'll take a little bit, And literally, the surgeon put her in a cab and like sent her to me because she didn't know what to do. She didn't know what to do. She had no idea,
Yeah.
and didn't want to take my calls, didn't want to talk to me, just fix the patient. You know what I mean? Like didn't want to know what I was doing or how it worked or how she just was basically
Just fix it.
Just fix it. I don't care. You know what I mean? That was the message that I got in the lines.
Yeah.
So, and same thing, she sent me another patient post-op who had lymph issues and same thing, didn't take my call, didn't want to just fix it.
Just fix it.
I'm like, okay. So so we fixed the gravel, but it turns out, so this woman was a 3 martini at it's 5 o'clock somewhere in the world,
Yeah, that'll do it.
For 50 years. And
oh my gosh.
Took some growth hormone inside of her cheek for 25 years, and I'm sure that the plastic surgeon didn't have any of this info. You know what I mean? Didn't know any of these things. I get this whole history because I ask the right questions. I ask probing questions because I need to know what's going on. With you.
I do too. I agree.
And because she would come to the office and I would do my lymph and it would get better, and then she'd come back in a few days, so about twice a week for a few weeks, and it wasn't draining between visits. It was draining while she was here, but it wasn't draining between visits. I'm like, so I did some muscle testing with her, and it's your liver, it's her liver, and I put her on some liver support, and this all went away within a matter of a couple of weeks.
Remarkable.
So it started draining between appointments. I've been working with plastic surgery patients for many decades.
Okay. Good to know you, Dr. Loretta. So we've been talking about lymphedema. You mentioned, lymphatics and drainage, etc. For, some people who are listening who may not know, what is the lymphatic circulation? Where is it and what does it do? I know I've mentioned, manual lymphatic drainage to my patients. They're like, oh yeah, I get massages regularly. No. So Dr. Loretta, what is lymphatic circulation? Where is it and what does it do?
Okay, so the lymphatic system is the next largest system to the circulatory system in the body, except it doesn't have a pump. Okay, there's nothing like the heart moving your circulation through all your tissues. So the lymph is a series of vessels and networks with nodes that are like way stations. Okay, and the lymph nodes are where they kind of pick up what they need, to take to the next place in your body, and also the drop-off center. So whatever schmutz they collect, it's like they drop it off and they pick up what they need and they go on. They drop it off and they pick up what they need and they go on. That's why lymph nodes get swollen.
Yeah.
Okay, lymph nodes get swollen because they get infection in them, because the lymph fluid is dropping off schmutz and picking up what it needs to go to the next one, the next one, the next one. Depending on where the infection is coming from, whatever's local is what gets swollen. So anybody that says to me, "Oh, I have swollen lymph nodes, my neck, and my around my collarbone and stuff," I'm like, "Have you had any dental work done recently? Have you had any dental infections? Have you had any ear infections? You have any sinus issues? All of that can cause lymph swelling. And so can cancer, lymphoma. So, the lymphatic system requires movement, physical movement. You have to be able to walk and do stairs and, bend and, breathe, do yoga, it's every day, just sort of everyday activity is fine. But when you have a problem, you need to up that a little bit.
Yeah,
So
you have to amp it up.
you may need to, do, flexion exercises. You may need to do dry brushing, in the showers. I find it's the easiest place to do that,
Right.
especially in the morning. You may want to do a rebounder, a trampoline, because pushing up against the gravity squeezes the lymph vessels. So
Yes.
they move, you know what I
Yeah.
mean? We start to drain. We have 2 lymph ducts in the body. There's one here under your left collarbone, and there's one here in your truncal region. So this is the thoracic duct, and then there's the cisterna-chyli. And those are the only two lymph nodes that you have in the body. See, and my whole thing about manual massage is you can't get to these ducts, okay? You can't get to them. You can't dig in somebody's neck and get down to that duct, okay? Or stick your hand in somebody's stomach and think that you're going to find the cisterna-chyli. There's some Brazilian cockamamie technique with these wooden paddles where they take them and they rub your stomach and they squeeze you and they stick them in and they're looking for the cisterna-chyli. They tout it as a lymphatic. I'm like, that's not lymph. I said, that's torture. I said,
that's medieval.
Yeah, I'm like, that's not lymph drainage. That's torture. That's the stupidest thing I've ever heard of in my life. So, it's like, of course they were doing it in California because that's where all the idiots live. But, they'll try anything.
So other than the cisterna-chyli and the one that's under the clavicle there, other than the ducts, the actual lymphatic vessels, they're fairly superficial, right? Because some people are like, oh yeah, I get massages every week, but it's different.
No, the lymph system is very, very superficial. And the thing is that too much pressure collapses the lymphatic vessels. So that's why lymph massage is really like this. Lymph massage is really very, very gentle. It's very, it doesn't feel like much. It doesn't, because you don't want to. So is dry brushing. Really, you just need a cloth. You don't need a brush. You just need a cloth or a wet cloth in the shower to, just gently move the fluid, all to, the thoracic duct or up to the heart, or, from the toes all the way up to the front of your legs, the back of your legs, get your tush, all that stuff. Get your,
right.
Right.
Now, in your book, you wrote, and this is a quote, "The state of your lymph is your body's best indicator of overall health." So how do we discover the state of our lymph? Please explain that. Is that the same as doing a cell test or an aging test?
I said that.
Yes, you did. Pretty good, huh? The state of your lymph is your body's best indicator of overall health. That struck me. I was like, that's sassy. I like it.
So because that shift of fluid shows how much toxicity is in your system, that tells me how well your lymphatic system is functioning. It shows us that there is a problem, there is an issue. That needs to be corrected. There's definitely, something wrong. And again, like I said, it all starts with some inflammatory reaction, and lymph is inflammation. People don't realize that when you sprain your ankle and it swells up like an orange or a grapefruit, that's lymphatic fluid. Your body innate intelligence is sending inflammation to that ankle, so you stop walking on it, so you stop using it, so it hurts. You know what I mean? It's causing, It's like, don't do that. Don't weight bear. Don't bend it. Don't twist it. Let it rest. Let it heal. And, and that's what inflammation is supposed to be doing. It's healing. You cut yourself, it starts to ooze. Well, that's lymph fluid.
Yes.
The lymph is there to try and prevent secondary harm, secondary infections from, taking place, or damage to the tissues, from taking place. So, it's really, like I said, it's the innate intelligence of the body that's trying to help you. But the lymph system is a protective system. And, but when we, abuse our bodies, or, don't eat right, or, don't take care of ourselves, or even if we do take care of ourselves, we have very toxic lifestyles, and, or what we live. I have a patient. So I have a patient who, she's like 69 years old, and a tall, thin, attractive woman, like 69, and comes to see me because she's got swollen lymph nodes all over. and has for 2 years. And
Oh, wow.
they give her a diagnosis of like follicular cancer.
Ooh.
So follicular cancer is like a non-diagnosis in my book.
I was going to say, it's like one of those rare things that
it's like,
anyone's ever heard about. Yeah.
I'm like, what is that? That's like a diagnosis, non-diagnosis. I'm like, what are they doing for you? Nothing. They're just watching my white blood cells and this, that, and the other thing.
Oh,
She's like, you're going to fix me, right? You're going to fix. I'm like, yeah.
Just fix it, Dr. Loretta.
You're going to fix me. Yes, I'm going to fix you. Yeah. So I put her on a protocol, metabolic detox protocol, just an initial starter.
Yeah, a basic one.
Get her cell test back yet, stool test, urine test. And so in less than a month, all the lymph node swelling went away, all gone.
Really? You fixed it.
Fixed it. White blood cells looking better. You know what I mean? The numbers are looking better.
Yeah.
I'm like, so I had sent her home requesting that she have cancer markers done. I'm like, didn't they do cancer markers on you? She's like, she's showing me these tests. I'm like, no, that's not here. They didn't do them. You should request cancer markers from your oncologist, and please get a hemoglobin A1C, because her lean muscle and body fat ratio was off, even though she's a tall, because everything's appearance with the medical people. She's a tall, thin woman. Her lean muscle and body fat ratio was off, you know? So I just for shits and giggles, I was like, let's just make sure that your receptors are doing what they're supposed to do. Right. You know, that you're not storing fat for, because your ratio is off.
Yeah.
Oncologists refused, wouldn't do anything. I'm like, you need a new oncologist. Just, you got to fire this person. This is not about her ego. This is about you and your health. You got to find a new doctor. So when the lymph node swelling went down and her white blood cell count improved, I said to stick that in your oncologist's hat and tell her to smoke it. You know what I mean? It's like, yeah, so much for her. Not doing anything.
God, Dr.
Doing anything for 2 years. I got the patient for 1 month. And her energy was bounding. She was so tired all the time. Her energy just went through the roof with the protocol that I put her on. So
good for you.
Yeah, she did.
Now, so let's say we're doing, as best as we possibly can. Let's say we live in a blue zone. We're doing pretty well. We're eating well. We're happy. We have support. All this stuff. So, what would you say we should be doing? Even let's say if we're doing pretty well, to maintain the health of our lymph circulation. You mentioned movement, right? You mentioned dry brushing. In general, are there any other things we should do just to maintain the health of our lymph?
You need to maintain your hydration. It needs to be good, clean water, not necessarily in plastic, but glass or paper. You really need to watch what you eat. You really, really need to watch your foods. You want all your proteins to be antibiotic and hormone and steroid free. And you want to say that on the label, not natural, not grass fed, not pasteurized. All those things mean absolutely nothing. They're grass fed. Okay, so the grass is all being sprayed with Roundup. You know what I mean? And the cows are eating it, or the chickens are eating it. You know what I mean? It's like, you don't know. You know what I mean? What does grass fed mean? It's like, it's supposed to be leaner. It's like, but the grass is full of pesticides. Yeah. So you know what I mean? So it's like, or cage. I love cage free, but they leave the door open, but the chicken doesn't take a walkabout. You know what I mean? It's scared. It's in its cage. It doesn't want to go anywhere. Right. But they leave it open so they can call it cage free. Free range. Oh,
the chicanery.
Yeah, but it is. It's all sales bullshit. So and the biggest BSer of them all is Whole Foods. Okay.
Really? So I call them corporate organic.
Okay. So the thing is that all of their meats were tested. Okay. And they are no better than any supermarket meat. They're all full of hormones and steroids and antibiotics. All that BS of pasteurized, humane, blah, 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 and all that shit that they got over the counter for the meat department. It's all bullshit.
But isn't that illegal to be selling something that you're saying is?
You know what?
It's not?
6 people deep, 8 people deep, all buying meat from there. It's like a bunch of idiots, a bunch of lemmings. So I mean, this is public knowledge. I didn't make it up. You know what I mean? I heard it on the news. If I heard it on the news, it's like this. No better than just supermarket meat. Go buy, for $10 less a pound. and you're paying a premium for the toxins you buy at.
Yes, you are.
Aren't you lucky?
Oh
Lucky
my,
you.
lucky you.
Yeah.
All right.
They make a vegetable medley. They make a California medley, 365 organic California medley. Where's it packaged? You tell me.
Not California. Please don't say China.
China. Yep. Packaged in China.
Oh
And last
my
time I
God.
checked, China didn't have any standards for organic.
Oh
Now,
my God,
call me crazy, but you know what? It's like when I was a kid, we didn't trade fruits and vegetables and with China because they use human fertilizer, okay, to fertilize their fruits and vegetables. Now, I don't think their practices have changed at all.
Right.
60 years. I don't think so at all. But now we owe them so much money. We opened up trade. That's why we opened up trade, so we could help pay them back. So now they're killing us. So now, you know what I mean? It's like we opened up trade so they can so China can kill us. They're trying to kill us and all our animals. So
and we're worried about the panda. Now, Dr. Loretta, you've been practicing a technique called Lymph-Biologics for over 20 plus years. What is it and how effective is it?
So Lymph-Biologics is my combination of metabolic detoxification with lymphatic drainage. So I'm the only one in the country who put this together as an effective treatment for swelling and inflammation, which essentially is lymphedema, okay, in this country. And as I said earlier, 10 million people in this country suffer from lymphedema, some swelling or inflammation somewhere in the body. Doesn't have to be just a big arm or a big leg. Could be a truncal region. Could be their whole body is just swollen. I see a lot of that, systemic lymphedema. People are just puffy, all over. And, I start working on them. They look like they lost 35 pounds. It's like all that fluid just, leaves. So, but yeah.
Got it. Now, are there any foods, for example, because, right, we all have to think about and maintain internal health as well. So are there any foods that we may eat to maintain optimal health of our total bodies or the lymphatic circulation, specifically for the lymphatic circulation?
So I tell people, as a rule of thumb, you really want to avoid white foods. Okay, so white foods are white flour, white sugar, white dairy, all dairies, cottage cheese, yogurts. They're like, Greek yogurt too? Yeah, Greek yogurt too. You know what I mean? It's like dairy is dairy. No cheese, and all grains except for quinoa and quinoa are inflammatory. Quinoa is just a darker quinoa. So all the grains, the brown rice, the white rice, all inflammatory. Ooh. So you want to avoid those foods as much as possible. So that leaves organic green leafy vegetables and fruits and lots of proteins, that you can have. Most people have some gluten sensitivity, and it's not really gluten. It's not really wheat. It's the pesticides that they put on the wheat. That's what people are responding to. The whole world didn't become celiac patients, but the silos that they store the wheat in, they spray that with so much crap, with so many chemicals. It's the chemicals that we're reacting to. It's not and wheat isn't really wheat anymore anyway. It's all genetically modified. I don't even know what wheat is anymore. But so I tell people to try to avoid wheat. You can have sourdough, you can have sprouted breads, you can have anything other than wheat based. So rye bread.
Now there are, in addition to those foods, are there any supplements that you can take in general to help maintain optimal health of the lymphatic circulation in general?
Yeah, there are some homeopathics that you can take. There are botanicals that are on my Instagram account. Nature's provides. They do a really great total body detox, a TBD formula. They do a really good immune health formula. They do a really good lymph formula. They do a really good black currant, which is for inflammation. They're all for inflammation. They're all for the lymph system. But they help to start draining, because that's what it's about.
Right.
You have to be able to drain. You have to be able to get this stuff out of you. So that's what these botanicals facilitate.
Wonderful. Now, if there were only one thing to do to support the lymphatic system, what would that one thing be? If people just want to take it slow and they're just hearing all this information from you, which is heady and again overwhelming, but so important. If they were to just do one thing, first step to support the lymphatic system, what would that be?
Call me.
That's fabulous.
Yeah, I talk to everybody.
That's fabulous.
There isn't a patient who walks in this door that I haven't had a conversation with, and I know what's going on with them because I want to make sure that I can help them before they get it. I don't want to waste anybody's time. I'm not looking to waste my time. So, if this is not something that I can help you with, I'm the first to tell you, and I'll send you someplace that can help you. You know what I mean? It's like I work with a group of, professionals who do some very interesting, and talented things. And,
yes,
I'm not always the answer for everybody.
Got it. And if there were only one thing to do to support the lymphatic system, what one thing would you avoid?
What would I avoid?
Yeah, to support again, if someone is just starting for the first time, they're listening to them, like, my God, I'm all about my lymph now, hashtag lymph 2024 goals, lymph. What's the one thing you would recommend that they do to avoid in order to support the immune system? Would it be like stop smoking, or what would it be?
Oh, yeah. I mean, of course, stop smoking, but stop drinking coffee.
What? Are you serious right now? No. All the Starbucks and the Joes and all these people around the globe, seriously?
Yeah, coffee's killing us. Coffee, you have no idea what coffee is doing to us.
No, I obviously have no idea. So explain, please.
Coffee is killing us. The caffeine is just killing our adrenal glands.
Oh,
people
my
are
gosh.
stressed out, wrecks, and not sleeping, and poor sleep, and all this kind of stuff. Sleep is so important to the body.
Oh, yeah.
Rest is so important. But yeah, caffeine is one of the things that you have to do in order to do my cell test. Is you have to not have caffeine that day. Okay, you can't have any coffee, no decaf, no green tea, no black tea. Drink lots and lots of water starting 2 days ahead of time because most people are dehydrated. They don't know it, but they're dehydrated. And no food for 4 hours prior to the test. So if you're coming in at noon, don't eat anything after 7:30 in the morning. Eat whatever you want before, but nothing after 7:30.
People are coming in a wreck.
Right. You can bring food or a cup of coffee with you if you want. People get caffeine sensitive, that kind of thing. But caffeine is, just like I said, one of the worst things that you can do to your body. Yeah. So, it really, and to do a cell test with caffeine and without caffeine, it's like night and day.
Wow.
Absolutely night and day. That's why we do it without caffeine.
Got it.
Give me 1 second.
Yes.
Hello. How are you? Don't go anywhere. Sit down.
All right, Dr. Loretta, this is the second to last question, and then I'll let you go back to seeing your patients and doing the fabulous things that you do. In your book, Lymph Link, you discuss the relationship between COVID and long haul COVID and toxicity. As we approach another winter and possibly, resurgence of COVID cases, long COVID, long haul, whatever you think, what may we do to protect ourselves?
Well, here's the thing. Long COVID is happening because people have toxicity in their bodies. Okay? The whatever that toxicity is why their long haulers took a turn, that they're still having symptoms. Mm-hmm. They're still having deficits, or they still can't taste or smell, or swelling at their fingertips, or headaches, or not sleeping. But the adjuvants in the vaccine that they put in the vaccine to target the COVID virus doesn't just target the COVID virus; it also targets self. That's why people are having these autoimmune responses from not just having COVID, but also the vaccines that they took for COVID, and they got COVID anyway. So, so it's a double whammy. You know what? I was an operating room nurse for many, many years. The best thing that you can do is wash your hands, not the germicide, not the antibacterial crap, because that destroys your immune system. Absolutely destroys it. So, Thieves is a natural brand of, hand sanitizer. I think it's one of the few that's out there. That's fine. But all the other ones, it's just alcohol. It dry, crack hands, kills the, natural bacteria that we have that helps us, our own immunity. So those, I see people, it makes me crazy. Squish. You know what I mean? Squish people constantly with the hand sanitizer.
Stuff. Yeah.
Hand sanitizer. It's like, you're nuts. You have no idea what you're doing to yourself.
Oh, gosh. And this last question is called the Fab Five. It is the signature question of the podcast. And it is, what are your top 5 recommendations for living a holistically beautiful, toxin-free, and fabulous life?
One of my 5 things, you should find someone you love.
Yes.
And love them wholeheartedly.
Yes.
You want to create a life that you love, and you want to live it powerfully.
Yes.
You want to stay hydrated.
Yes. Number 4.
You want to remember to play. You got to remember to play and have fun.
Good. And number 5.
You need to enjoy yourself.
And number 5.
And number 5 is love your animals.
Oh. You have pets, I take it.
I do. I love my girls.
Oh, that's wonderful. Well, Dr. Loretta, thank you so very much for your time, your expertise. You got me all fired up. Really appreciate your time here and all of this information that you've disseminated. I know you and I will see each other again soon. So thank you.
Thank you
for your insight and your expertise.
Thank you for having me. I appreciate it. This was very fun.
Thank you. This brings us to the close of this week's episode of the Forever Fab podcast with my guest, Dr. Loretta T. Friedman. Read Dr. Loretta's book and buy it on Amazon.com, Link. To begin your detox and become a patient of Dr. Loretta's, visit synergyhealthassociates.com. Follow Dr. Loretta on social and get some of her resources that she mentioned during the podcast by following @Synergy Health Associates. Thank you for listening to this week's Forever Fab podcast episode. Until next time, stay beautiful and fabulous, inside and out.
Thank you for listening to this week's episode of Forever Fab, the podcast on fashion, the art of living, and all things beauty, curated by Dr. Shirley Madeir, MD. Live beautifully and help make the world a more beautiful place.